is the U here in between. And then the choroid process is this other side here, the opposite of the mandibular condyle. So this part here. Next, I will be presenting the vertebral column. Thank you. Hi, so next I will be continuing my presentation with the vertebral column, and that is the cervical, the thoracic, the lumbar, the sacrum, and the coccyx at the bottom. But I believe the coccyx is not part of the vertebral column since it's just sacral. The two primary vertebrae, or the curves I should say, are the thoracic, which are these up here, and the sacral. Those are the first ones that we developed as babies. The secondary curves are the cervical, which are the ones on the neck. Whoops, this is moving a little bit. The cervical and the lumbar here. On the cervical vertebrae, we have 7 vertebrae, and that they are called the C1 through the C7. So 1, 2, 3, 4, 5, 6, 7. So these first ones here are composed of their cervical vertebrae. And the atlas, it's a faucet that articulates with rounded condyles, allowing them for motion. So these allows for our head to do this type of motion, up and down. The unique thing about the transfer processes for all cervical vertebrae is the transfer foramina, the bifid spinous process, and overlapping vertebrae of the body. The thoracic vertebrae that we're going to be talking about, which are these here, there's 12 of them. Those will be the spinous processes. So on these here, I noticed on the PowerPoint videos that I was watching, this I think these were compared to a I forgot the name of the animal, sorry. But these were compared to another animal. Anyhow, so this were compared to a hippo, I think, and then these were compared to a giraffe for the look of the nose and the ears. So that's how I memorized the thoracic as a giraffe bones, and then these are the hippo, the lumbar. Anyway, so the spinous processes is like the middle, which is the nose of the giraffe. And then the transfer processes are on the sides, which are the ears. The intervertebral foramen, the root of each spinal nerve, the spinal artery, segmental artery, communicating veins, internal and external plexus, meningeal nerves, and transformational ligaments pass through here. And a good way to show you that is I'm going to pull the vertebrae apart, and you're going to be able to see the silver tube. If you can see that, can you do a close-up? Here, let me get my pen and lift this. So wherever you see the silver, sorry, it's hard. Wherever you see the silver, that's where all the bones and the ligaments and all that stuff that connects to the vertebrae would pass through. Next, I will be going over the body or centrum, which is this here, the body or centrum of the spinal, of the thoracic vertebrae. And then the position of the intervertebral disc, those are these little fine lines that you see going across. So you see the bone here, the body, and then these are the intervertebral disc into each one of the vertebrae. For the lumbar vertebrae, which are these down here, the hippo look-alike, those consist of 5. We have a total, it's a total of, I want to say 9 together with the sacrum and the coccyx. So we have 5 fused sacral vertebrae, and then we have 4 fused of the coccyx here. Coccyx here and sacral here, and then these are the lumbar. For the next following presentation I will be doing, it will be on the sternum, and I will be going to the front body of the of my skeleton here. So So this is the sternum, which holds our ribs together, coming together at the front of our body. The top portion is called the jugular notch. And then followed, we have the manubrium, which is the second part of the body here. And then thirdly, we have the xiphoid process, which is down here. It's the bottom portion of the sternum. And then the middle portion in blue is the body. So again, the green is the manubrium, the blue is the body, the yellow is the xiphoid process, and the red is the jugular notch. Moving on to the ribs, I have the first 7 ribs, which is 1, 2, 3, 4, 5, 6, 7. The first 7 ribs here are what they call true ribs. And then our false ribs are 8, 9, and 10. And then 11 and 12 are what we call the floating ribs. And you can see why, because they are just kind of floating. They don't attach to the sternum like the rest of our bodies, like the rest of our ribs do. These are the ribs that models, supermodels, and famous people cut to make their waist cinch a little smaller. But they don't understand, unfortunately, the consequences of chopping these off. And those are having difficulties breathing when they get older. So the tubercle of a rib is the knob to which a rib articulates with the transverse process of a vertebra. I can't think. I'm gonna say this is the head. So this is the head, this is the neck, and the body of my, I think it was supposed to be head, body, and of the vertebrae. So I will come back and try to get one of these vertebrae out so I can break it down and explain exactly where the head and the vertebrae of the vertebrae is. Thank you. Back in explaining how the ribs and the spinal cord articulate together. As you can see, each one of the ribs attaches to the spinal vertebrae, and that's how they basically articulate. So if these attach to like the cervical here, most of these here, when they move, I wish I could move them so I could show you, but they're stuck together. So when you move the body, your spinal cord is basically sending the message out, and your ribs are part of the moving motion onto your vertebrae. So your vertebrae gives flexion to your ribs and your body for movement. Thank you.